Hello and welcome to Pelvis and Hip Pathology. The first pathology we're going to discuss is ankylosing spondylitis. Ankylosing spondylitis is an inflammatory disease that can cause the vertebrae to fuse together. And what happens is new bone forms as the body tries to heal itself from this inflammatory disease. And you can see what happens here is this fusion in these anterior vertebrae. The fusing, of course, makes the spine less flexible. Signs and symptoms begin in early adulthood, and they include pain and stiffness in the lower back and hips, especially in the morning or after periods of inactivity. There's no known cause for ankylosing spondylitis, but scientists think genetics may play a factor. And there's no cure for ankylosing spondylitis, but anti-inflammatory drugs and therapies can help ease some of the symptoms. Now, the reason we're talking about ankylosing spondylitis in the pelvis unit is because it's usually first seen in the SI joints. So again, you could be imaging a pelvis and notice that the fusion of the SI joints, then it will extend all the way up the spine. And as you can see in this x-ray here, notice this is a vertebral body, this is a disc space, vertebral body, disc space, etc. And you can notice, just like this drawing, that there is fusion, or bony bridges they call it, in the anterior vertebral bodies. Now some people think this looks like a piece of bamboo. So the nickname for ankylosing spondylitis is bamboo spine. So again, this is an inflammatory disease, usually first seen in the SI joints. It will then progress up the spine, causing extensive calcification. And of course, this will limit motion or mobility in the patient. Okay, next we have avulsion fractures. And we've learned avulsion fractures before, but just as a reminder, an avulsion fracture occurs when a tendon pulls away a part of a bone. Now, signs and symptoms of an avulsion fracture in the pelvis include sudden and severe pain, swelling, bruising, and limited or painful motion. This is often seen in young athletes who are maybe playing a sport. Let's say they're running, they stop suddenly, or they're running hurdles in track and field, and it's caused by the force of the tendon sliding over tuberosities such as the ACEs. Treatment includes rest, ice, anti-inflammatory medications, and even physical therapy. This injury should be better in about 4 to 6 weeks with rest, and physicians will use x-ray and range of motion exercises to help diagnose this x-ray. Sometimes it can be easy to miss an avulsion fracture on x-ray, so the physician will use other exercises to help diagnose. In this x-ray here, you can see it's a little bit grainy, but I can tell this is a pediatric patient based on the epiphyseal plates. And you can see a small avulsion fracture here near the acetabulum. Okay, good. Next, we have chondrosarcoma. And remember, the term chondro refers to cartilage. So a chondrosarcoma is a malignant tumor of the cartilage, usually occurring in the pelvis and in the long bones. Chondrosarcomas are rare in patients under the age of 20, and in fact, they're more common in men over the age of 45. So as you age, certainly your risk of developing a chondrosarcoma increases. Surgery to remove the affected area is very common. Occasionally, amputation is necessary. And the prognosis is better the earlier it is detected. In fact, 90% of patients who have early detection of chondrosarcoma have a survival rate of at least 5 years. And this is the second most common type of bone cancer after osteosarcoma. And remember, there's a difference between primary bone cancer and then metastatic bone cancer, which we'll talk about in a few slides. Okay, developmental hip dysplasia or developmental dysplasia of the hip. This is a congenital condition, meaning it's present at birth, and it's actually a dislocation of the hip. So if you look at our x-ray here, you can see this hip is normal, but the left hip is actually dislocated from the hip joint or from the acetabulum. So developmental dysplasia is caused by a problem with the way a baby's hip joint is formed before birth, during the birth process, and even in the months after birth. Possible causes include cramped quarters in the uterus, or even if the baby is in breech position. Mild cases will get better on their own. However, severe cases need treatment with a brace or even surgery, and you can see that here. Signs and symptoms include a unilateral clicking noise and different leg lengths. And if you look at this x-ray, you can imagine how the right leg would be longer than the left leg. The left leg would appear shorter because it's out of the joint. 1 in 1,000 newborns are affected. However, 1 in 3 newborns, it's estimated, have some degree of hip instability. And developmental hip dysplasia usually affects girls more than boys. We can use X-ray or ultrasound to evaluate this condition. However, usually we prefer ultrasound because newborns have less dense bones, and of course, it's no radiation exposure. So treatment includes casting or surgery to realign the hip, again, which you can see here. And typically the outcome is very good with treatment. However, if developmental dysplasia of the hip is left untreated, children can have uneven leg lengths, as we discussed, which can cause difficulty in walking and, of course, pain. Doctors will check the hip movements of infants during their regular checkups. So if you're a parent, you know that babies go in for frequent checkups, weekly when they're newborn, and then monthly, and then yearly. And so in those first few months, doctors are looking for developmental dysplasia of the hip. Now remember, these patients are going to be seen repeatedly for follow-up with this condition, and they're going to have a lot of imaging. So it's really important that we're precise with our positioning and that we avoid repeats if at all possible. Next, we have Legg-Calvé-Perthes disease. This disease is characterized by aseptic necrosis of the hip. So aseptic means free from bacteria, and necrosis means the death of cells in an organ or tissue due to a lack of blood supply. Now, necrosis can be caused by other things, but the most common cause is a lack of blood supply. Notice the x-ray here. The right hip is normal. Okay, this is an epiphyseal plate, of course, but you can see here the left hip, the femoral head is, again, dying. Signs and symptoms of Legg-Calvé-Perthes disease include limping, pain, stiffness, and limited range of motion. And this disease is usually unilateral, which we see in this x-ray. It's only affecting one side. Legg-Calvé-Perthes disease is 5 times more common in boys than girls, and white children are more often affected than African American children. The cause is unknown, however, scientists think it may be hereditary. And treatment includes surgery to remove the dead or necrosed area, and then probably placing a prosthetic in place. And again, these patients are going to have frequent follow-up, so it's really important that we're practicing ALARA. All right, next, metastatic bone cancer. So remember, metastatic means it's spreading from the original tumor to other parts of the body. So breast, prostate, thyroid, kidney, and lung cancers are more likely to spread to bone versus other types of cancer. In patients with breast and thyroid cancer, bone is often the first site of metastatic cancer. The malignancy is spread to the bone via the circulatory or lymphatic systems. Metastatic tumors of the bone are much more common than primary malignancies, which we talked about a few slides ago. Bones that contain red bone marrow are often more common metastatic sites, so think spine, pelvis, femur, ribs, and skull. The image here on your slide depicts a nuclear medicine bone scan, and that's a really helpful tool for evaluating any metastatic bone cancer. You can see anything that's showing up black is metastatic bone cancer. And also here's an x-ray of a hip, of course, and you can see there's some metastatic bone cancer here in the neck. Okay, so we're going to pause part 1 here. We'll pick up part 2 with osteoarthritis.